With regard to knee surgery, the part of the remit is to deal with the entire range of knee conditions, and that in itself poses quite a degree of difficulties in that we have a range of ages from the very young through to the very old, and a range of conditions which can involve severe injuries, sports injuries, and arthritic problems. And sometimes those conditions will all occur or can occur simultaneously, and the pattern of those injuries again will range from the mild to the severe. So in terms of the more severe types of injury or problem that we see, as an expert knee surgeon, I tend to get those type of problems. In addition, an unfortunate consequence of surgery is complications, and again I tend to see some of the complications that can occur as patients presenting to me. And again, what's part of the remit of being a specialist surgeon is you try and remedy those complications of surgery as well. I've probably got 3 typical patients. So patient 1 is a patient around the age of 30 who's quite sporty, plays regular sport, most commonly in this area football, rugby or netball. Also get skiers in the winter season who sustain an acute sports injury. They tend to have a range of problems involving injuries to the cartilage or joint surface or one or more of their ligaments, and the key ligament injuries that we tend to deal with surgically are those of the anterior cruciate ligament or ACL, or the MCL or medial collateral ligament. In terms of the second type of patient, those patients between the age of 45 and 55, they may well have had either a significant traumatic or sports injury in the distant past, and they've either re-injured their knee or their knee has started to cause trouble again. A proportion of those people will, just by dint of their age, be a little bit older but still be playing sports and then still present with sports injuries, and they often have a combination of early arthritic problems and ligament type issues. And then my final typical patient will be someone who's around retirement age who will have an end-stage arthritic knee joint, or will have had a joint replacement, and that joint replacement has itself worn out and is causing symptoms.
Thank you.
I probably, even in my practice, tend to operate only on about 30% of all the patients I see, and that means that probably 2 in 3 have alternative treatments. The alternative treatments that are available are to see some other healthcare professional, most commonly a physiotherapist, but we also refer to our osteopath colleagues. Sometimes we refer to our rheumatology colleagues because we pick up a medical condition or an inflammatory arthritis that requires specific medical treatments. But then there are a range of patients who can and are treated simply by understanding their condition and knowing their condition as it is at this point in time, and either modifying certain aspects of their lifestyle or by taking certain simple medications such as anti-inflammatory tablets, etc. The activity modifications that we most frequently suggest are fairly simple swaps of higher impact to low impact exercise, for example, stressing the importance of muscle conditioning, and things like diet and weight loss. There are a smaller group of patients as well that I don't operate on, but I put various types of injection into their joint, and the two types of injection broadly are cortisone injections, which is a very powerful anti-inflammatory medication, or the newer type of injection, which is called, or as a group are called Hylan injections, which are synthetic joint surface injections, which can act as a protective barrier for the inside of the joint.
Brilliant, thank you.
The timing or the duration of symptoms is very closely linked with the severity of the symptoms and what the underlying problem is. So if your symptoms, for example, if you tear a cartilage, a small percentage of people will be really pretty disabled by that injury, and it just will not improve. And particularly if the knee is stuck in one position such that they can't straighten it fully, that really becomes an urgent issue that should be seen within probably a couple of weeks of injury. If, however, that's how the injury initially starts, but then after 2 or 3 days there's a gradual improvement, then the urgency, as it were, becomes less. And we would say certainly the persistence of symptoms for around 6 weeks is probably a trigger for that group of patients. Again, in terms of the goals and outcomes, what we're working towards as much as possible is a patient-related outcome of restoration of normal function with no symptoms. That's the ultimate end point, as it were, and that's what we wish to provide our patients. We would love to give all of our patients 100% guarantee that that's going to happen, but unfortunately the type and severity of various conditions mean that that's not possible. Overall, the likelihood that a given condition will be restored or reversed with such that a patient has normal function with no symptoms is in large part related to the severity of the underlying condition and also the type of condition. Therefore, if you're a patient who has a medium-sized isolated cartilage tear, I would be expecting a 95% chance of complete resolution of symptoms and normal function. If you are a patient with an isolated anterior cruciate ligament injury, I would be expecting an 80% chance of achieving the same thing. There's a slight difference between patient satisfaction and achieving normality, and as someone that keeps quite a close eye on, as it were, both of those parameters, I would certainly say that overall, taking the anterior cruciate ligament surgery as an example, 9 out of 10 patients are happy, but only 8 out of 10 will achieve or get back to their pre-injury sport, and probably only 2 in 3 will get back to their pre-injury level or intensity of sport. But still, the majority are happy with their surgery. Overall, with joint replacement surgery, again, we have satisfaction rates of 90%, but restoration of all function and abolition of symptoms again occurs less frequently than that. We're very fortunate in orthopaedic specialties as a whole because a lot of our surgery is very consistent and works very well, and we have overall we generate a high level of satisfaction. So we often end up with comments, thank you letters and such like, saying thank you for giving me my life back. And that's really heartening. It's one of the great things about the job that I do, is that we are able to restore people back to normal function, get them back to a normal family life, interactions, and the sort of social activities, as well as work and sporting activities. And overall, we would say that well over 9 times out of 10 we achieve those things.